This is KSUT Public Radio. Regional news is next. The booming senior population in Colorado will strain the state budget on both sides. Healthcare spending for low-income seniors will rise at the same time that the working age population decreases, resulting in decreased tax revenue to pay for those services for seniors. Those are a couple of the conclusions of a new report on the cost of aging in the state. It comes from the Colorado Fiscal Institute, a nonprofit focused on economic policy. For the Rocky Mountain Community Radio Coalition, KGNU's Sam Fuqua spoke with Kendall Stevenson, a senior policy analyst and one of the authors of the report.
How we looked at this, and I think how a lot of demographers and economists will present demographic statistics, is to kind of break the population into three groups, right? Those that are, under 18, those that are of working age, right, between older than 18 and under 65, and then the 65 and older group. We're basically showing that really just in the next decade, that under 18 group is barely going to grow, right? That's only going to grow by 4.6%. That working age population is going to grow by about 12%. And then the 65 plus population is actually going to grow by 30%, right? So that's just really an enormous change. There's already been a big change in the last decade, but really over the next decade, we really start to see the whole of the baby boom cohort really finally hit into that category. That looks different depending on the county that we're looking at. And in fact, some counties will have a negative, right? They'll have less individuals 65 and older than they do today. But some of these larger counties will have much faster growth rates than the average, right? So Weld County will be growing 46% in that 65 plus population. Douglas County over 55%, looks like 56% in that group. One thing I'd say, if we could probably have done this report again, we would have even split that demographic of 65 plus into additional categories, right? Because we know that the 65 to 85 group looks a lot different than the 85 plus group. And there are really some weird dynamics going on with just that within counties as well.
Can you say a little bit more about if we were to parse that 65 plus and talk a little bit more about 85 plus? I'm assuming that's fewer people, but potentially needing a lot more services.
Yeah, that's a great point. I can't really point to any county specific statistics, but I think you're absolutely right that just given the high cost of elder care, right? I think nationally we have good statistics that are basically showing about a third of that 85 plus group are basically not going to have enough income or private insurance to pay for long-term care services. And essentially the result of that is twofold. We're either going to see an increase in elder homelessness or, and this is definitely the case, more stress is going to fall onto the family members who are basically going to fill in. And they fill in either by providing the care themselves or by paying for the care themselves. And this essentially is going to make it harder for those people to save for their own retirement, right? And so we have this kind of vicious doom loop in that sense. But essentially, yes, we know that things just with health, of course, become exponentially harder after the age of 85.
So let's talk about the healthcare a bit more. And you alluded to this earlier, the Medicaid program, but can you give us a general sense of what they're costing the state now and how much more we may be looking at in cost over 10 years?
Certainly. Yeah, I can definitely speak to the Medicaid component of this. And essentially to, actually be eligible for Medicaid as an older adult does require having exhausted many of your assets, whether that was, winding down your retirement accounts, selling wealth in the form of a home. But we know that basically total expenditures for those 65 and older in the state is around 1.8 billion right now. We expect that to increase to maybe 2.6 billion by 2035. That's an increase of like about 800 million right there, right? Medicaid, of course, is a program that is paid half by the states, half by the feds, right? So If the feds continue to pay for half, which we don't know that is necessarily going to be the case, Colorado is basically going to be on the hook for another really 420 million by 2035, and then close to 700 million by 2050. And essentially, the way the state budget looks right now, that is going to be very difficult to do. And those are rather conservative estimates from our end, right? We basically just tried to look at all across the state how many individuals 65 and older are currently on Medicaid and might be receiving these long-term care costs. What might we be able to expect in 2035 and 2050? And we, assumed basically that there is no change in costs. And we quite frankly know that in 2035, 2050, the costs of some of these long-term care services are absolutely going to be higher than they are. So yeah, I guess we'd say we'd really be ringing the bell there that Medicaid is the key thing that's going to be driving costs for the state. I will also briefly just mention, this is quite important, is that Medicaid coverage of nursing home care is mandatory. That is for states everywhere, that is going to be the case. Coverage of home care is actually voluntary within the states. So we could easily see that voluntary home care component being something that might be on the chopping block as states seek to cut costs due to these big changes that have come out of HR 1, the One Big Beautiful Bill Act.
Kendall Stevenson is a senior policy analyst with the Colorado Fiscal Institute. He was speaking with KGNU's Sam Fuqua, and that story comes to us from the Rocky Mountain Community Radio Coalition, of which KSUT Public Radio is a member. Colorado lawmakers have passed a bill to guarantee Medicaid coverage for Planned Parenthood patients after the federal government cut the funding this summer. For the Colorado Capital News Alliance, Kyle McKinnon has more.
The bill directs the state to use Medicaid dollars to reimburse the cost of services like cancer screenings, birth control consultations, and STI testing. It's part of Colorado Democrats' response to congressional Republicans' tax and spending package known as the One Big Beautiful Bill Act. The federal measure blocks large nonprofits that also provide abortions, like Planned Parenthood, from receiving federal Medicaid reimbursements. Jack Teeter is with Planned Parenthood of the Rocky Mountains. He says the move significantly disrupted care.
We've had to cancel patient appointments, resume them, cancel them again, resume them again. That is not a sustainable way for our patients to be able to access health care.
The Big Beautiful Bill's provision is currently paused while it faces a legal challenge. But Colorado Democrats say they want to be ready if the challenge fails. The bill is now waiting on Governor Polis's signature.
After days of negotiations over a controversial artificial intelligence policy, lawmakers saw their efforts on a deal fall apart late in the day Monday. For the Colorado Capital News Alliance, here's Benta Berkland with the story.
Colorado lawmakers have spent their special session grappling with competing visions of how and how much to regulate AI decision-making. Democratic Senator Robert Rodriguez says ironing out a path that works for everyone has been impossible.
Business, consumer protection advocates, labor, and educators came together, but big tech didn't like the deal. Because they don't like the liability, and let me be clear here, we could be the first state in the nation to enact guardrails around AI that result in liability to these systems when they cause harm.
What lawmakers have agreed on is a pause. They'll delay the state's impending AI law for an extra 5 months, giving them more time to work out issues next session.
Content produced by the Colorado Capital News Alliance is funded in part by the Corporation for Public Broadcasting.
Support for public policy reporting comes from the Gay and Lesbian Fund for Colorado, promoting programs designed to ensure all Coloradans have the same opportunity to thrive. More information is online at gayandlesbianfund.org.